as of today is not going to go to Pinnacle and abuse Denisha or Odash, because I will tell the police to get up there and arrest those criminals that try to perpetrate and destroy our property, because they're not Rastas as far as I'm concerned, because I know the Rastas in the both denomination there.
All right, I'm on it.
Yes, we have to give it a wrap. Well, thank you so much for being in studio with us, being on the phone, Denisha, and being in the struggle for the Pinnacle, because it is an ongoing issue. It is not something that has been resolved yet, but we hope that it will be very soon, and that in the advantage of the Rastafari community. Thank you so much for helping us explore Pinnacle. We'll be calling on you further, because until it's resolved, we will still be seeking you as anchors of this struggle to be helping us to get the clarification that we need. Stay with us, listeners. Jerry Small comes in shortly with Straight Up.
Morning and welcome to Straight Up for today. Today we broadcast live from the Sickle Cell Unit at the University of the West Indies Mona campus. The Sickle Cell Unit, because today is Sickle Cell Awareness Day. Annual thing. We've been here about 3 years now straight. And today's broadcast comes to you courtesy of Ensure, the brand Ensure Nutrition in Charge, Pharmaton, Be Alive, Precision Extra, your best friend for diabetes health care, Be Complex, promotes general health, Painol, cough and cold, for rapid relief of all flu symptoms. And today, World Sickle Cell Day 2014, under the theme, What You Don't Know About Sickle Cell Disease May Hurt You. What you don't know about sickle cell disease may hurt you. We're going to be having many special guest experts, patients, people, and families living with the coping of sickle cell disease. But I want to just take you into some of my thoughts and thinking about some of the things that have been happening. First, I want to play a little piece of music. It's in tribute not only to the people, you know, that the African, the black-skinned people of the world, those of the African continent origin, have the highest incident and predisposition towards sickle cell, full-blown sickle cell. And also, today we're celebrating from Monday gone the birthday of Leonard P. Howell, one of the organizers and formalizers of the Rastafari movement in the late 20s to the early 30s. And we might have a little 5-minute visit here from his son, maybe. And also, mainly I want to pay tribute to that 15-year-old Ethiopian youth. A 15-year-old Ethiopian youth in the United States has been separated from his Ethiopian mother. She is in Ethiopia. And that youth climbed into the wheel well, where the wheels of the airplane, of the jet plane, are lifted up into the belly of the plane and the doors closed so that the plane can fly smoothly. That 15-year-old Ethiopian youth, he climbed onto the struts of the wheels and allowed himself to be lifted into the wheel well of the plane and flew thousands of miles from California to Hawaii, because he knew that the plane was going west, and he knows that the world is round. And if you go west far enough, you will reach back to your eastern origin, which is Ethiopia. And that 15-year-old youth in America decided that by the hook or the crook, he is returning to his motherland and to his mother. Very emblematic of the same struggle of the Rastafari brethren and sistren, starting with the Pinnacle family of Leonard P. Howell. That by the hook or the crook, they will recover their motherland and they will recover their mother homestead. The homestead is in Pinnacle and the motherland is in Africa. Let's hear from Carlos Malcolm, 1964. Ethiopia, long-time traditional black African music from Jamaica and from the Western Hemisphere. Ethiopia, Carlos Malcolm. That's Carlos Malcolm flying over the world and touching back down in Ethiopia. Now, talking about touching down, the there's a dispute between the transport operators all over the island and the government is bullying the transport operators in order to put JUTC and some of their other favored friends in a good earning position. Now, in the midst of this dispute, government has organized a vote to disqualify the Office of Utility Regulation, which is supposed to regulate the transport industry and the relations between the various elements of the transport industry and the public. They have organized moves to disqualify the OUR from regulating the transport industry. In the middle of a legal dispute, they are having a legal dispute with other entities, and they use their political power now to disqualify the OUR in the middle of a dispute. They are shameless and corrupt. You know that. Shameless and corrupt. That's what them take office for. Them take office to be shameless and corrupt and to steer things in the way that they want. You're going to hear more about this. Now, Caroline Gomes, she resigned yesterday. Caroline Gomes, she resigned from the executive of the Jamaican for Justice after they mix up and infiltrate and hijack the Jamaican for Justice. The remaining members of Jamaican for Justice and the new director of Jamaican for Justice object to how they use a kind of stealth and crept in unawares with their programming of the youth in collaboration with the militant homosexual lobby, the militant international homosexual lobby. So now, some of the boys' homes, one of the boys' homes that they use to start off this grooming of the youth, come on and saying nice things about the program and saying that we network and we collaborate with reputable NGOs. In other words, what I must say, when we say nice white people and brown people and decent people, we drive up in a nice Range Rover and them carry. We collaborate with those people because everything will go all right. And them say them and Mr. Finnegan and the next one, Randy Finnegan and the next one, talking on behalf of Sunbeam Boys Home. And them say them always value being able to network. You know, network. When you link up with important people and start a cocktail party with VIP, that's what them value. Well, Caroline Gomes resigned, and when Cliff used a presser, it was obvious now that one. She resigned because she get vexed because some more of the Jamaican for Justice directors and the new director start to dispute and to question what motive and what authority she have to put through them thing there. So she says, following a stormy meeting, I realized that there are irreconcilable differences. In other words, she knows that she and them can't get back to there. So she walk out of the meeting. Walk out of the meeting. You remember how she was crowing? She was crowing last week, say, no matter how the people demonstrating outside the university gate, they cannot get Professor Bain get his job again. And she crowing and she laughing and she strutting. And on Cliff Hughes' program last week, Panwa, Impact was it? She there strutting and crowing and laughing and celebrating the victory from the high ground, you know. Well, although she not lose no money because she have a bigger job now, she find herself in a very similar position like what Bain, like what them try to put Bain into. And who the cap fit make them wear it. And she said she hope that what happened to her will not happen to any future director. Or what happened to Miss Osborne, Key Osborne, the person who take over from her. Well, she hope that what happened to Key Osborne won't happen to any future director. Would they make a statement one day and next day them have to go find out. When them find out say they are being tricked, them have to go make a different statement. But this is typical of the hijacking of office, hijacking of programs, hijacking of governments, hijacking of churches, hijacking of organizations all around the world. All around the world. Then I heard on Lambert Brown program yesterday evening with the resignation of Caroline Gomes and other people. A caller was saying to Lambert Brown, like how people have certain principles and resign when them find themselves in trouble when they have done wrong. Why the PNP don't resign when they are found doing wrong? Lambert Brown said to him, so maybe you should shout louder. In other words, if you talk louder, people will resign, but you're not talking louder. I'm kind of mock the guy. So the guy repeats, why you people don't resign when you're found doing wrong, individuals found doing wrong? Lambert Brown said they were elected by the people. In other words, once you are elected by the people, you don't have to resign for not doing no wrong, because the people back you on anything that you do. You are authorized to stay in office until your time up. Is that so? Is that so? I saw some of the brochures. When I saw them on the TV last night, I realized that I've seen some of them before. And when I see them displayed, I always try to take up one and two of them and look through them. I saw some of the brochures that they're using to groom the youth into sexual lifestyles under the guise of human rights. Under the guise of human rights. These guys. And one of the brochures, inside it, them depicting different people and different lifestyle and different choices and different mating. Man and woman, man and man, men and men, women and women. And the picture of them have for the man and man, you see two man and hold hand, them back turn to you. Two man and hold hand, and guess what them put on for the man them? Now two red, gold and green Gansy. To try groom the youth them. Say it's alright if two men hold hands and go and take vow and exchange rings and commit them life till death do them part, and them have on two red, gold and green Gansy. That is the way how they infiltrate, impersonate, and corrupt people little by little with a big budget that they have. Big budget. But I want to congratulate Helene Coley-Nicholson, journalist from quite a while back. I used to be on the same station with her when I was at Hunt 102 more than 10 years ago. Helene Coley-Nicholson. And you know, most of the great female journalists, about half of the great female journalists in Jamaica, about half of them eventually take up legal training, because you know that the craft of journalism has a lot of bearing on justice, legality, and the regulation of people's life. So a lot of them become lawyers. Helen Coley-Nicholson has done that. But she has not relinquished her values that she born with, and values that she has probably enhanced and even improved since the time that she born and become responsible for herself. Helen Coley-Nicholson. So great to see her last night, representing a new formation named CAUSE, C-A-U-S-E, reiterating that people will not be allowed to come from outside, no matter how big is their budget, and come and impose their values and their new laws upon people, like the people in Jamaica, the vast majority of people in Jamaica. And she's one of the people organizing the march, not only a rally at Mandela Park, but a march from UWI Gate on Sunday the 29th of June. A march from UWI Gate to Mandela Park in Arbitrary, in solidarity with Professor Bain and freedom of speech and the human rights of all human beings. No special right for any people. You don't have any gay rights or no homosexual rights. You don't have no sickle cell rights. You don't have no Rastafari rights. All you have is human rights, and human rights cover the need of all human beings. No male rights, no female rights. No gay rights, no homosexual rights, no Rastafari rights, no sickle cell rights, no cancer victim rights. Just human right. Right is right, and wrong is wrong. And I congratulate again Helen Coley-Nicholson. Now the appointment of Lisa Hanna in law, one of her in-laws, she has appointed that in law to be one of the trustees of Jamaica Heritage and make rules about the disposition of land and the preservation of land and the desecration of land. And the appointment of Lisa Hanna's in-laws to Heritage Trust is right in line with the incestuous relationship between JFJ Gomes and CVC Carolyn. Incestuous relationship. Having sexual relationship and liaison inside the close family. It is quite in line. And we're not talking about the sexual part. We're not talking in terms of no sexual. Incestuous refers to improper relationship between close members of a certain formation. And the word incestuous is frequently used not in terms of sex, but in terms of improper, close relations where vested interest and conflict of interest arise. And the relationship between Lisa Hanna and her in-law is improper and in line with the impropriety of Jamaican for Justice Gomes and CVC Carolyn. Carolyn Gomes at one at the same time, representing CVC, which is a a vested interest group looking out for special rights for vulnerable people. In other words, they claim that vulnerable people have special rights. Rights above and over the rest of the population of humanity. It is improper, and that's why Carlin Gomes had to resign. That's why Jamaican for Justice distanced themselves from Carlin Gomes, because of the impropriety. So many times even founders of organizations have hijacked the organization. Many times, you know, founders of organizations themselves take on to themselves kingship and royalty because they have founded this thing, and they themselves hijack the thing in the direction that the people are unsuspecting. It's like you have an airline, you book tickets and tell people that you're flying to Hawaii, and in the middle of the flight you decide that you're not flying to Hawaii, just like how the busman and taximan take up people at Jamaica all the while. And when them reach a gas station, them tell people them say no, go further after them collect the money. When you say busman and taximan are collect money halfway, you know say something is up, As them collect them money, you see them stop at them girlfriend gate. Doctor go and buy Guinness and I tell you if you don't like it, come off of the bus. Well, this is the incestuous result of the kind of relationship where organizations are hijacked even by the founders. And Carlin Gomes is one of the founders of Jamaican for Justice. And yet the founders themselves sometimes hijack the thing. Well, Jamaican for Justice have distanced themselves from her. She resigned from it. And the relationship between Lisa Hanna, the Minister of Culture, who have responsibility over the heritage affairs of Jamaica. It is improper for her to have appointed or to cause her to approve the appointment of her in-law, especially in view of the fact that the in-law brother has a conflict with some of the historical people of Jamaica, the Howellites, the Pinnacleites, the Rastafarians, the Africans. It is improper. I will dare you to come and try to penalize us. It is improper. And the pretense is there right through the pretense of ignorance of what is taking place in the children's home, and pretense that you didn't know this and that about what name? What the director of affairs in the ministry name were there? Forget what name. Yes, man. What name again? Bartley. You never know about Bartley long time. You didn't know about Bartley long time, and you pretend that you just find out about Bartley. You never know Rastafari long time, you're going to find out about Rastafari. And I'm not talking in an invested interest as a Rastafari myself. Let's run the numbers. We have an outside broadcast here, live from the Sickle Cell unit at the University of West Indies Mona campus. And today is the World Sickle Cell Day. Under the theme, what you don't know about sickle cell disease may hurt you, just as what you don't know about hijacking will certainly hurt you. Run the numbers a minute. Well, I say Monty, we have two Monty now. Monty Blake's supposed to come here, or Winston Blake. But I say Monty Howell here. Hello, Monty Howell. Can we have a word with you, please? Yes, sir and ma'am. We have 2 minutes, quickly. Monty, sit down quickly, please. My brethren, come sit down quickly. You were here a couple of years ago. Yeah. Yes, sir. Yes, Monty Howell, in Jamaica again for the celebration of your father's birthday. How are you doing?
Yeah, thank you.
Great to see you.
Yes.
One thing I want to tell you, just keep up your heart. There's no defeat in this thing here. We're introducing brethren again. In born and grow up Pinnacle, like yourself.
Yes.
Zanaf,
yes, sir. Zanaf. Yes, brethren. So, here it is, you are here. And I advised a certain brethren the other day, that it would suit them and all of us that every unit of the Rastafari houses should have a male and a female ambassador that keep contact with all other houses so that these kind of conflicts, we preempt them before.
Right.
But Monty, how are you doing? You're just here for a few days. We have 1 more minute.
Yes, I came down on Sunday to celebrate my father's birthday.
Yes, sir.
And
everything going good?
Hopefully, I was hoping that we would have gained more traction in terms of the one lot.
Yeah, the one lot that the government wanted.
Yeah.
Don't worry.
They're really dragging the feet. Yeah.
Yeah, don't worry yourself though. You know that even now you might not know it, you have lived a long life already, and you're liable to have plenty more, but I don't think, nothing you're doing is in vain.
Sure.
But my brother, know it go again.
Yeah, I'm here for the celebration as well. I was there Sunday, Monty, my big brother.
Yes.
And as I said, the crown prince of Pinnacle.
Yes,
this is Howell's son, and I was born there.
Yeah.
And
there's a lot that you, brethren, have to impart to the younger people.
yes,
And you are not useless. I think your use increase with the passage of time. Gray hair and white hair is just like winter. Winter is one of the most beautiful happening. One day, even this lady here, she might not change shape, but her hair might get white.
Yes.
And
That
she will
might
get more
if she
beautiful.
live
And the
long
next one
enough.
is the Dr. Knight here.
Oh.
Yes, ma'am. Yes, Monty, we don't have much time, but if you are around tomorrow, I wonder if you could pass through again tomorrow. Because I didn't remember that we had this dedicated program today about the sickle cell thing.
Oh.
okay.
What time?
Come 10 o'clock, please. I thought it would be lovely if you could pass through tomorrow.
10 o'clock.
Yes, sir. But so
Yes.
good to see you.
I'll be
Yes,
here.
Danab.
Yeah, I'll be here as well.
Yeah, man. One love for that.
Yeah,
Yeah,
man.
There's so much you can pass on to the youth. You've been doing it already.
Definitely.
Yes, sir. Do we go for a break? Yes, we'll go for a break straight up. Back to Straight Up. I'm your host, Jerry Small. I think this is the third year straight we've been here at the Sickle Cell Unit at the University of West Indies Morning Campus, celebrating Sickle Cell Awareness Day. And I have to ask Professor Jennifer Knight Madden if today is actual World Sickle Cell. It is today.
It is today. Today is the 19th.
The 19th.
19th of June every year is celebrated as Sickle Cell World Day.
Yes. And as the theme is what you don't know about sickle cell disease may hurt you.
Yes, that's right. Every year we spend time trying to get the message out to the general population that sickle cell disease is important. But many times people feel that it doesn't affect them at all.
Yeah.
But ignorance is not bliss.
No.
Many of our mothers come in when their baby is just diagnosed with sickle cell disease, and they're in shock because they didn't know they had a risk.
Yeah.
But here they are having to deal with a child with a lifelong disease.
Yeah.
And, we are here to help in that process, but it is not easy. So what you don't know may hurt you. If you don't know that you have a trait, you may end up having a child with sickle cell unexpectedly.
Yes, because if you don't know, your partner, whether it is a marriage partner or the partner with whom you have 1 or 2 children without being married, might also not know that they themselves have the trait.
Absolutely, because the trait has no symptoms usually. So you are perfectly healthy, and if you don't do the blood test, you don't know. So out of every 100 Jamaicans, 15 out of 100 are at risk of having a child with sickle cell disease. So if you're in a classroom with 30 people, chances are maybe 4 or 5 of them have a trait. Think about it. In every year group in a primary school or in a high school, think about how many people that is. So, and some people don't learn. So they have one baby with somebody with a trait, and then they go out there and find another one.
Yeah.
So before you're so in love, you don't care.
Yeah.
Find out your own status and that of the potential partner. And if you find out your status, then at least you know your risk. 1 in 4.
Yeah.
If you both have a trait, a 1 in 4 risk of having a child who is affected by the disease.
2 points. One is this, from us growing up, and I suppose the same thing with most people. The image in people's mind of danger of sickle cell is if a person is extra slim and yet eats food and extra slim, or maybe don't have appetite and do extra slim, and from a person is bulky and looking kind of rosy and have some nice cheeks. People say, no man, you can't have sickle cell.
Well, as a group, overall, more people with sickle cell disease would be wasted than in the general population or slim. But we certainly do have individuals with sickle cell disease who are, sometimes we have to talk to them about the weight.
Yeah.
And remember that sickle cell disease has more than one form. So what Jamaicans normally call the full-blown is the SS disease, which is where you get an S from your mother and an S from your father. But you can get an S from one parent and another gene. The names are not important, but maybe the C, giving SC, or the thalassemia, so you have S beta thalassemia. Some of those persons have milder disease. And in fact, some of them are even diagnosed as adults. But again, what you don't know may hurt you, because if you have a mild form like hemoglobin SC disease and you're going along merrily and you get pregnant and suddenly you're in a life-threatening situation because of your sickle cell disease. So the good thing is that the Ministry of Health does test mothers for the sickle cell during pregnancy, but a lot of women are still unaware of the result. So what you don't know may hurt you. Also, I mean, we have teachers who perhaps may not be as aware of sickle cell as they should be, and so they're unable to really deal with children in their class who have sickle cell disease properly. So they need to drink more water, so they need more bathroom breaks. Yeah. Sometimes they may have leg ulcers that need to be put up. Sometimes they can't swim or do PE because it may cause pain. And you as a teacher would hate to know that your actions are actually causing a child harm. Similarly, you know, our children have parents who work, and I think employers need to be aware that sometimes something will suddenly happen with a child with sickle cell disease, but that should not be a reason to really, you know, separate the person from their job, because they are living with a child with chronic illness and they do need that support.
Just as they need a job. Now, as we're talking about unawareness, quite recently there was a dramatic story, you know, lesson brought home to us. A lady has a baby recently, and then she takes some illness. You know, to see people say you take ill. Mm-hmm. In other words, they take an illness, take some kind of illness. No one is able to understand what it is about. None of the doctors understand. Well, people start to go to other sources of wisdom, like Reader Man, and Euler Man,
and
Obia Man.
Right.
And time is being wasted.
Time is being wasted because
eventually it reached to a prayer man. And the prayer man is vexed because the money finished by the time it reached him.
Oh dear.
And the woman dies. Meanwhile, him is vexed. The woman dies on a table outside the prayer tent.
Oh dear.
Meanwhile, him is berating them for dunning out the money where it should have come here. So now it can suppose some sickle cell condition had obscured what is the sickness of, because many doctors not aware of sickle cell.
Well, most have some exposure to sickle cell disease in their training, but again, in conjunction with the Ministry of Health, we plan to do an island-wide training for especially the doctors that look after children, to update them on sickle cell care, because sickle cell disease can affect every part of your body. Well, not the hair, because the hair is already dead, right? But it's...
Hair is dead?
Well, only the root is alive. Oh. The part that comes out that you see, that's already dead. Oh. But sickle cell disease affects every part of your body. So a child can present with a stroke, with a sore, with pain. Well, when you have a stroke, sometimes you do end up in coma. They're also more at risk of seizures. They're more at risk of wheezing. So a child might come in, you think it's asthma, you think it's pneumonia, it's actually sickle cell, it's at the root of it. So
it could be been with this mother.
Well, I really don't know what the situation was with that mother.
With a lady who.
But as I said, in persons who go through antenatal care, they would get tested. But you know, sometimes we do have mothers who present ready to deliver, and if they have not been tested, they do. If they have sickle cell disease, they're at risk of having problems for themselves and for the baby. So what we're really saying today is, don't think it doesn't affect you. It affects all of us as Jamaicans. It is so common. 1 in 15% of us adults are at risk of having a child with sickle cell disease. 1 in 150 babies born in Jamaica actually have sickle cell disease. So all of us need to know our status, that of our partner, and certainly that of our children.
Being born without legs, or some other extreme so-called deficiency. It doesn't have much prospect of being perfectly corrected, although it can be compensated by maybe a prosthetic limb or so on. But with sickle cell,
but that wouldn't be sickle cell.
No, what I mean is, with sickle cell, is there no prospect, or is the nature of the disease such that there will never be a cure, but only management?
Okay. Well, let's start with a cure. It can be cured through bone marrow transplantation, which is not available in Jamaica now, and is very expensive, and in some cases doesn't, as we say, take or leads to death. So it's not an ideal solution. And after bone marrow transplantation, there are some problems associated as well. But it is possible. there is really exciting research where they're trying to actually do stem cell type research to insert the normal hemoglobin into your own cells so that you can be cured. That has been happening with thalassemia. 2 persons have been cured of thalassemia in France, and thalassemia is a cousin to sickle cell. And the hope is that the next person that they do will be somebody with sickle cell disease. It's extremely, it's a research thing now, very expensive, but maybe in decades to come, when that technology becomes less expensive and more broadly available, people can be cured. But no, we actually do have a therapy that works to decrease the severity of disease in some patients, and that's a drug called hydroxyurea. And it was originally used to treat persons with tumors, and then it was found that it caused a type of hemoglobin called F, or fetal hemoglobin, which is the hemoglobin that the baby has while the baby is still in the womb. And that actually mixes out the sickle hemoglobin and actually makes the disease less severe. So giving this medication, particularly in persons who have had a lot of problems with pain or acute chest pneumonia or have had a stroke, we have shown that it can decrease the chances of having another stroke, and it can also improve the life of the person. Less pain, less pneumonias and acute chest. Doesn't work for everybody, but for those that it works, it's good.
What do you think about stem cell research and the morality of it, Carl?
Well, that's a big one. We have to have a program for that alone. You know, everybody has personal views on that. I personally think that using the type of technology I'm talking about is where you actually take your own stem cells and reuse them. So you make those cells that come from the person's own body able to do new things. I have absolutely no problem with that. I personally don't agree with taking, you know, the fetus and storing them for the purpose of stem cell research, because I see a fetus as a person. Because I believe that once you have conception, that's a new life. Yeah. But it's a very controversial topic, and everybody has their different opinions. Certainly, in sickle cell disease, in other places like France and Brazil, they actually also use a person's own stem cells to help in leg ulcers, which can be really difficult, because can you imagine having a sore in your leg that lasts years and never gets better? And also, they've been using it in the hip problems.
Yeah. Well, thank you very much for starting off the program so well.
Okay, my pleasure.
Jennifer Knightman, and we're going to enjoy for the 3rd year. You're going to enjoy being here.
Thank you so much for coming. We really appreciate it.
Yeah, man. Thank you very much. Let's go for a break. Yes, welcome back to Straight Up. I'm your host, Jerry Small. We're broadcasting live here from the Sickle Cell Unit at the University of West Indies Mona campus. Today is World Sickle Cell Awareness Day. World Sickle Cell Awareness Day. And the theme is, what you don't know about sickle cell disease may hurt you, so it suits you to know. Now we have some time here for a few phone calls. So call me now. We're going to have some time in between these interviews. So this is one of the times we can take 2 or 3 phone calls. Could you run the numbers, please, and start to pass on phone calls to me, straight up.
For straight up, we have a choice of numbers. 702-3470, 702-3470, 702-2585, 702-2585, 977-7638, 977-7638. Toll-free line 1-888-991-5155. Toll-free 1-888-991-5155. Digicel number 618-1823. Digicel 618-1823. All straight lines. Text line 899-7657. Text line 899-7657. We also stream live at www.newstalk93fm.com. www.newstalk93fm.com.
Welcome, welcome back to Straight Up. We're broadcasting live today from the Sickle Cell Unit at the University of West Indies. You know, sickle cell disease is a disease of the blood. It's not a contagious disease, one that you can catch. Contagious means contact. Contagious means you can get the thing through contact. C-O-N-T-A-G. Contag is really about contact. So contagious. Contagious means that you can get it through contact with somebody else. Sickle cell disease is not a disease you can get through contact, but it can be developed through contact between your parents. If both your parents have a tendency towards having this disease, and they come together and they germinate and you come alive, you are conceived because of contact between 12 parents that have sickle cell characteristics, you might be born with this disease. That's the only form of contact, not really contagious. So it is not one of the diseases that you can get through touch or through food or any other kind of contact. But it suits us to understand this disease more so because of that. More so because of that. Because it is born in people, and therefore people are not aware of it. People probably growing comfortable with themselves and not being aware of what it is that is different about themselves. They might say to themselves, well, not everybody can run the same speed, so what if I can't run as fast? Not everybody can swim underwater for the same length of time, so what if I can't? And not know particularly that it is because of some characteristic of the condition that causes the impairment of their ability, the cutting down of their ability. So it is poverty can be thought of as a contagious disease, because poverty can be developed because of contact with conditions and contact with other people under the heel of poverty. But certainly poverty can be coped with if people learn how to do so. And injustice like poverty can be coped with. And as I cope with it, I don't mean to get comfortable with injustice. You cope with it by getting to grips with it and wrestling injustice to the ground. Good morning and welcome to Straight Up.
Good morning, sir.
Welcome, sir. How are you doing?
Yes, you get very low, but anyway, can you hear me?
I hear you very well.
Very good. I was wondering if these people bring the drinks along with them, the sponsors.
Which, yes. You mean the tonic drink?
Uh-huh.
Which one are the drinks?
Well,
like Ensure and that?
Ensure.
Oh, so you want to come up here and get one of the Ensure?
No, well, I would you just ask one of my boys, either Kevin or Quasi, to get a case for me.
A case?
You know?
Well, I don't know if you have a strong case.
Huh?
I don't know if you have a strong case, can get a case.
Like
how you bring it into the public domain.
Uh-huh.
It look like there's no turning back.
Uh-huh. Well, if you can find one of them there, I could have a card, and if you tell me how much it is, I think I could find the cash for it as well.
I thought you had a card where you could.
I have the card here, but I could also find whichever.
Right,
I don't know what the.
So we can make a sale. We're actually making a sale for Ensure then.
Huh?
We're actually making a sale for Ensure. Well, yes, we have to make sure that you get it.
Yes. Just ask how much the key is for it.
Yes, sir. That is a very successful. We start off on a good leg.
Huh?
The program earning some money there.
I'm not hearing you too clearly.
I say we start off well. It's a very welcome phone call.
Yes. All right. How do I know? Because we have to get the cash, or Quasi or Kevin could pay for it and come and collect it, bring it down and collect the cash, or if you want.
All right, off the air. We have to make that arrangement off the air. But your name is good, sir. Thank you.
All right, no problem.
Thank you very much, yeah?
Right, okay.
Yes, sir. Good morning and welcome to Straight Up. Hello? Have another call. Good morning and welcome to Straight Up. Hello? Go ahead, please.
Hello?
Yes, sir. Welcome. Welcome.
Good morning.
Go ahead, please. Yes, good morning.
Yes, I was looking at television the other night and saw the Vice President of the Jamaica Chamber of Commerce discussing the shortage of factories in Jamaica and the help that they're not getting from the government. I think you're old enough to know that this country once had a stocking factory, a socks factory, a bulb factory, a shell and cotton factory, several knitting mills, and one whole lot of garment manufacturers that were making garments that could have been accepted anywhere in the world.
Yes,
they're all shut down. Government doesn't seem to want manufacturing going on in this country, but it's an employer of people.
Right.
These people need help. And we need to start a campaign to see to that they put restrictions on non-essential imports and start to support the local industry. I understand that the factory that this gentleman was speaking about had put in a bid for a hotel that the government is building. And they said that the quality was not good enough. That same hotel outfitted the Spanish Court Hotel, which is the envy of every single hotel in this country. Something has to be done.
Yes. Well, look,
your comments.
You know that for production and
I'm hardly hearing you.
Yes, you know that for production to be most economical and to be most profitable, you need to have the capability to produce around the clock. And if there's insecurity in an environment, in a community, and people cannot work safely after dark, and people may not start work before dawn because of insecurity, your costs are going to be far more than your competitors.
I can understand all of that. But we have the talent in Jamaica. We can do it. There was a survey done by a company called Salmon in the 80s that told us that Jamaica had the best seamstress in the world. Think about it. When a child goes up in the country, what's the first thing she sees in her grandma's bedroom? A sewing machine.
A sewing machine.
Right? Yet we have no garment factories left in this country. There were only about 2 or 3 of them. There were like 40 or 50 of them.
Yes.
Right? We'd rather import goods from Taiwan and China and Singapore. Rubbish.
Well, now, people like yourself, citizens like yourself, and business people like the Chamber of Commerce, they have to bring about a change in the political representation in Jamaica, where people are elected on the understanding that they are going to promote and bring about production in Jamaica and job creation.
Even if they were manufactured locally and it's 10% higher, we can import Singapore, Taiwan, China, or wherever. But at least our people are getting work. The government will get back that money. Because then you will have more people in jobs.
Well, I'm hoping.
That's right.
I am hoping, sister, that I'm on an outside broadcast today, and we have most of the time is dedicated to the sickle cell problem. But I'm hoping that when I'm back in the studio from tomorrow, you will call the program again and let us discuss this thing more.
I'll be happy to, because there's a lot of it that it burns us when we can manufacture, produce certain things that we're imported. We don't need to import it.
All right, well, thank you very much.
It's a first-world country.
All right, thank you very much, sir. Let's go for the 10 a.m. headline. Straight up.
From NPR News in Washington, I'm Corva Coleman. Sunni militants in Iraq continue to battle Iraqi special forces for control of a key oil refinery north of Baghdad. The Beji facility refines about a quarter of Iraq's oil for use domestically. President Obama continues to review possible options for the U.S. in Iraq. Secretary of State John Kerry told NBC today that he rejects criticism that the U.S. is trying to take action there too late.
People on the ground in Iraq have seen the increased intensity. We've been watching this happening. We have been engaged in efforts over the months. We've been beefing up our assistance, our presence.
Secretary of State John Kerry, Iran appears to be downplaying any notion of cooperation with the U.S. on Iraq. NPR's Peter Kenyon reports that Iranian media are filled with negative reactions to working with the country's longtime enemy.
Iran's conservative media are leading the rhetorical charge against working with Washington to stem the rising violence in neighboring Iraq. Armed Forces Chief of Staff General Hassan Firuzabadi is quoted as saying cooperation between Iran and the U.S. will never take place and is meaningless. He also says there's no need for Iranian troops in Iraq in the wake of President Hassan Rouhani's pledge to do everything possible to defend Shiite holy sites in Iraq against Sunni extremists. In Vienna, Iranian and American negotiators remained focused on nuclear issues, with no further discussion of Iraq reported. In Oslo, meanwhile, a spokesman for President Rouhani told reporters that if the nuclear issue is resolved, that might clear the way for cooperation on other matters, including Iraq. Peter Kenyon, NPR News, Vienna.
In Afghanistan, presidential candidate Abdullah Abdullah is challenging the legitimacy of last weekend's election. NPR's Sean Carberry reports Abdullah's announcement that he won't recognize the outcome of the election is stoking fears of a political crisis.
At a pro-Abdullah demonstration in Kabul, about 100 people are chanting "Death to the Elections Commission" and "We'll defend our rights with our blood."
Unfortunately, this is what many had feared.
Graham Smith with the International Crisis Group in Kabul says a close, bitter second round has always been the worst-case scenario. Unofficial numbers are indicating Abdullah, who won the first round, is trailing in the second. Abdullah is alleging that President Hamid Karzai and elections officials have engineered large-scale fraud in favor of candidate Ashraf Ghani. Elections officials say they will continue counting votes and final results will be announced in a month. Sean Carberry, NPR News, Kabul.
Afghan officials say Taliban militants attacked NATO fuel trucks waiting at the border with Pakistan today. At least 3 suicide bombers targeted the trucks. 37 NATO fuel trucks were destroyed. On Wall Street, the Dow Jones Industrials are down about 4 points at 16,901. The Nasdaq is down 5. It's at 4,358. This is NPR News. President Obama will award the Medal of Honor today to a Marine veteran. Retired Corporal Kyle Carpenter is being honored for bravery in Afghanistan. He saved fellow Marines by stepping between them and a grenade. He suffered severe injuries and blindness in one eye. The Philippines have submitted a formal claim for compensation 1.5 years after a U.S. military ship got stuck for months on one of its internationally protected reefs. From Manila, Simone Orendine reports the Philippines had originally assessed the damage at more than $1 million.
The superintendent of Tubataha Reefs Natural Park says administrators are glad the claim was finally submitted. Superintendent Angelique Sonko says Philippine and U.S. officials estimated damages to be $1.5 million after they found 7,700 feet of crushed coral.
We all agreed that that was the size after having measured it. And yes, we were happy about it, and we think it's fair.
The USS Guardian was grounded for 73 days in the early part of 2013. It was a 224-foot minesweeper and had to be taken apart to be removed. Tubataha is a World Heritage Site with lots of rare marine animals. For NPR News, I'm Simone Orendine in Manila.
German rescue teams have successfully brought an injured explorer to the surface of a very complex cave system in the Alps. Cave researcher Johann Westhauser injured his head in a rock fall 12 days ago and has not been able to surface since then. His rescuers had to navigate narrow horizontal and vertical shafts to bring him out. Westhauser helped discover the cave system in the mid-1990s. I'm Corva Coleman, NPR News.
News Talk 93 FM. Heard everywhere.
Yes, welcome back to today's live broadcast of Straight Up from the Sickle Cell Unit at the University of the West Indies Mona campus. And today's World Sickle Cell Day, Awareness Day, World Sickle Cell Awareness Day. And this year it is being celebrated under the theme, what you don't know about sickle cell disease may hurt you. And today's broadcast comes to you courtesy of Ensure Nutrition in Charge. That's a product. Pharmatan, Be Alive, not a product. Precision Extra, your best friend for diabetes health here. B Complex promotes general health. Painol, cough and cold for rapid relief of all flu symptoms. We have here now our second resource person and guest, Nurse Marilyn Grindley, who is a research nurse and counselor. Welcome, Nurse Grindley.
Thank you, Jerry.
I remember you from last year. But as I said, the hairstyle is a little bit different. But you, as a research person, you are finding out more and more things. So your expertise is growing, as well as the expertise of the whole department and of Jamaica in sickle cell management.
Yes. Well, presently we are doing a lot of research on sickle cell, and my job in particular is quite wide. I educate, I'm involved in research and also clinical care.
Yeah.
And they are all important areas of the sickle cell unit. As the neonatal screen counselor and nurse in charge of the neonatal program, I have to ensure that all babies, infants, born at Victoria Jubilee, Spanish Town and University, that are screened from birth and they are suspected of having sickle cell, that they come here for further testing. And after that testing is done and it's confirmed that they have sickle cell, then I have to counsel them on what sickle cell is.
Counsel
parents, because the whole point of counseling is to empower them with information. A lot of them come here, they are anxious, they are hearing about sickle cell for the first time. So by giving them all this information, it alleviates their fears and anxieties. It's also a big part for us to empower them with this information, so if anything should happen in the home environment, they know how to care for the children.
Yeah.
So we teach them about pain management, what to do, what not to do in a home situation, because they are children. There are certain children, depending on the type of sickle cell that they have to get monthly treatment. And the whole point of screening babies is to pick up the sickle cell before the symptoms appear.
Yeah.
So all that is very important.
So you also will be training people too. I mean, apart from training patients and how to manage it.
The other nurses, yes, as well, to assist if I am unable to do it. You have other persons who can carry on if I'm not there.
Yeah.
But the counseling part is foundation for the parents who are new to sickle cell.
As I say, parents, I see a father there, very involved in the management of
and we encourage both parents to be here, because a lot of times the information given to the mothers alone, they need that emotional help, that emotional support from the fathers. So we encourage both parents to come if they can.
And that helps, that works against one parent leaving all the blame for the condition.
Yes.
It's true you make a child have that. It encourages no parents not to leave any blame on others.
That's so important. The mothers, because probably they are the one who carry the children, we are the bearers of the child. We are more accepting. The fathers, they are telling you this is not from their side, it's only from the mothers, and then you let them know that, well, the only way you can have the full-blown sickle cell is from both parents.
Yeah.
And we also let them know that by looking on someone, you can't know that they have it.
Yeah.
The only way you can know is by doing a blood test. Now, part of our culture is that we're afraid of the needle.
Yeah.
So a lot of men particularly don't like to come and do the test. So they are holding on that, saying it's not on their side. But we know that it has to be from both parents.
Yeah.
And a lot of them come, but a lot more could come.
Yeah. What would you like to see? What improvement in the conditions of your job would you like to see for the next year?
Well, for more persons to get tested, because by knowing your status, it can determine whether you will have children, 1. 2, it will determine who you have children with. And 3, if you do find that you have a child with sickle cell, you know the importance of getting them treated. We want more persons to be aware of the condition and what can result from having sickle cell if you don't get treated. So we encourage all Jamaicans who have never been treated to get tested. Sorry, who have never been tested to get tested.
But in terms of physical facilities, equipment, maybe transport, what you would like to see in NHS?
Well, currently we are collaborating with the Brazil government. They are sponsoring what is called the HPLCs and equipment that we need to go island-wide so that we can test a larger population. So in a few months that will be rolled out, and then we will be able to go island-wide. And so mothers on the north coast, the west coast, will be able to get their children, babies, tested.
Talking about coasts, you treat people from you train people from other islands and countries?
No. Other persons from the Caribbean, other English-speaking Caribbean, they also are referred here. So we also have patients, children and adults, who are referred to our clinic. So we don't only see Jamaicans, we see persons from the wider Caribbean. We also from time to time have visitors who have sickle cell and they are vacationing in Jamaica and they might get ill and they are referred here. We also have research that's conducted in collaboration with persons overseas, and of course the sickle cell unit is internationally known for its high standards of research.
Yeah. So you know anybody in Little London?
Yes, my mother.
Oh yeah, your mother come from Little London?
Yes.
What part of Little London?
Little London.
No, but you have different. Little London is quite a big district.
It's just Little London. We are on the main in Little London.
But I know different places in Little London. But her name is Mildred
Tullis.
Tullis.
Yes.
Yes. Well, I hear that she's a listener to this program here straight up.
Yes.
That's great. She know that you're going to be coming on today.
Yes, she did.
That's great. So we thank her for her support of this program as far west as Westmoreland. And then now you have a daughter.
Yes.
Name what?
Talia Grindley.
Yeah.
She's also listening.
She's not in Little London.
No.
What does she do?
Well, currently she's looking a new job.
Yeah.
Yes.
But she don't start listening to straight up yet.
Yes, she is.
Oh yeah.
Yes.
Well, that's great to know.
Yes.
That's a form of preventive medicine. Not true.
Yes, it is.
Well, thank you very much for having been here, and Miss. This is Nurse Marilyn Grindley we're talking to. So there's 3 generations of them. We are in contact with our mother, Mildred Tullis from Little London. Good morning to you, Miss Tullis, Mrs. Tullis, Miss Tullis, and to Talia Grindley, our daughter. And Marilyn Grindley, Nurse Marilyn Grindley is a research nurse and counselor for the Sickle Cell Research Unit here. And it is not the first we have been in contact with her. Well, all the best.
It was a pleasure,
Well,
Jerry. Thank you too.
All the best till next year.
Thanks.
Thank you very much. Yeah, we have another guest coming in right away. This guest was specially recommended. Specially recommended because he's a social worker. And no, this is not a social worker. Social worker who here? This is Dr. Bowles. This is? Alright, just yes. I need to get I needed to come back. But this is Dr. Bowles. How are you doing? Dr. Andrew Bowles. How are you doing, sir?
Good morning.
Morning. Are you from Jamaica originally?
Born and raised.
You're born and raised, yeah?
Born and raised.
Well, welcome here. So at what point in your, apparently you have decided to specialize in the treatment of sickle cell or blood disease or what?
Well, not particularly sickle cell disease. My area of expertise is physiology, human physiology.
Physiology. The makeup of the body.
Makeup of the body, how the body works.
As is, not as it ought to be, but as we find them.
As we find them.
But of course you have to be able to compare with what is expected at birth, a so-called normal structure.
Uh-huh.
So you have to have a norm to which to compare.
That's right.
Yeah. So early in medicine you were attracted to this kind of, or were you directly because somebody spotted something in you?
No, well the truth, well this started when I was doing my master's study.
Oh yeah?
So I did my master's in sickle cell disease.
Yes.
Then from there I moved and did a PhD.
Yeah. So master's, this is in the line of physiology.
Physiology.
Yeah.
So even though you're doing physiology, you have to find a particular area to study. Whether it be diabetes, sickle cell disease, hypertension. My focus was sickle cell disease primarily because of the prevalence of the condition in Jamaica. So there's a need for it, and that drove me to make that decision.
So your findings, obviously you have unique findings on sickle cell disease.
Yes.
Either the findings are unique or your evaluation of them are unique and are proven to be valuable.
Well, for me, for one, I've come up with some unique findings. As I said, my area is the incidence of leg ulceration in sickle cell disease.
Leg ulceration,
leg
okay.
ulcer.
That's the sores that never get better.
Yeah,
on the legs.
Yeah, so even though sickle cell disease are bombarded by many complications, most of which we can't see with the bare eye because they're inside our bodies. Leg ulceration, on the other hand, is one complication which is cutaneous, which affects the skin. And it's generally on the legs, and it takes months, sometimes even years to heal.
I think that is one of the most common forms of infection, long-term infection with which human beings are familiar. Everybody else seems to know at least one person who they have seen having an infection or a sore that never gets better. It's usually on the legs.
Yes. It's also common in people with diabetes.
Yeah.
So it's common in diabetes and sickle cell disease. So that's one way in which the two diseases have certain commonalities.
Are these ulcers provoked by injury?
Yes.
Or it is by...
So in sickle cell disease, some of the times the ulcers just show up spontaneously. And they kind of...
without getting hurt?
Without getting hurt.
So it show up with a soreness first or inflammation, something that somebody might scratch and
so it may start as a tiny, very small tear, laceration to the skin, and over time it progresses to something much more.
And the body is not able to cope with the normal healing process. Like what did happen to me? I was doing some mechanical work on a car the other day.
Yeah.
And I got pinched by one of the tools. Get a cut here. I go on working. I don't want to go and clean it up right away. I clean it up in about 5 minutes now. 5 minutes time. But I don't clean it up properly because I want to get back to the job. And it kind of heal over the top, but inside is the infection. I just ignore it and go and live with that. And I know, I know I could have do better.
Yeah. But obviously, the best thing to do would be to get it dressed immediately so you don't get it infected.
And cover it. Get dressed because I did clean it up and put antiseptic, but I didn't cover it. Sorry, you go ahead.
So in sickle cell disease now, so for example, because the immunity is affected, the blood, as we know, is largely affected. The blood doesn't flow as easily as it should.
To the wound.
To the wound.
To repair the wound.
Yes, because the sickle cells, they become stuck in the circulation, especially in the smaller blood vessels. So you have a wound, you need blood for it to heal.
Fresh blood.
Yeah, which will supply fresh oxygen. In sickle cell disease now, we believe that there's a blockage to the blood flow, a possible blockage, and this may be involved or be part of the reason why the ulcers take so long to heal. And why they have such a high rate of recurrence, because even people who have ulcers that heal, you may see them 3-4 months later on down the line with the same complication.
At the same spot?
Same spot. Sometimes it affects both legs.
And they know what with the superstition in Jamaica and in other places. When a condition takes a long time to be corrected, people start to attribute the slowness to some other thing, supernatural, overnatural, and supernatural. Not true?
True.
And so them seek other doctor outside of you
And because of this now, sickle cell disease, patients may suffer some degree of humiliation, embarrassment. People may scorn them, think that it's because of poor hygiene why they have it, which
poor hygiene.
Yeah, it's not really their fault. It's because of their physiology.
And part of people might believe it's a curse.
Or even that.
So there's a lot of work and a lot of things that you have to study when you're treating, because you're not only treating the person body, you're treating their mind.
True. That's true. That's right.
So what kind of obstacles you come up in your research now? You strictly do research, or you have to interact with people?
Well, on the most, I have to do some interaction with the patients, because I mean the research is a multifaceted process. I mean, you start off with your proposal, then you have to get ethical approval from the hospital.
Ethical approval, that means if everything is all right.
Everything is all right.
And everything is proper.
Yeah,
and in the good interest of everybody.
Yeah, particularly the patients you're studying.
But you could be just studying it because for your benefit.
Yeah, I could be just studying for my benefit,
and not caring about
it's of no significance whatsoever to the patient. So that's where.
So you could be allowing a patient to go and develop the ulcer more for you to see how, and so on, if you are not a trusted professional.
If I'm an unethical researcher. Yeah, definitely.
So you have started to train other people?
No, not per se.
But your accumulated knowledge is where you will be required.
In time.
To train, and certainly you're going to be required to write.
Well, from now on, after it, definitely, because I mean, a major part of scientific research is at the unit we are involved in several scientific research, both locally, regionally, and internationally. And this is high quality research that has to meet a certain standard for publication in international journals. And for me, even from a PhD, that has work that has been published internationally. So the work has to be of a certain standard.
So in addition to the training and the honing of the skills of observation and all that, you also have to develop your skills of expression and language.
Definitely.
If you're not using the language properly, you're not going to pass on information.
Because you have to communicate not just with local people, you have to communicate internationally.
So you find out this kind of combination of skills that you're learning. It helps probably mature even faster than what a normal human being would be matured at 30 years or 40 years.
I would think so. Because I mean, from a young age, I was exposed to not just scientific explorations. From a laboratory perspective, I had to familiarize myself with various literature. I had to read very broadly. And this is, writing is an important part of that. In order to get across your findings. Because if you can't communicate your findings with the world, the research doesn't really make any sense, and you're just wasting your time and the patient's time.
It become confined. What's the sense? So what part of Jamaica you grew up?
Grew up, well, several. Born in Trelawney.
Up in the hills?
A place called Ulster Spring.
Well, I don't know. You might not believe. From you come here, you start talking, you remind me some of my relatives them from Albert Town.
I have relatives from them.
And they are both well accomplished. Some are engineer, most of them are scientists, engineer in a bauxite, engineer in electrical engineer and so on. Them names small, and my telephone come here and remind me of some of them. I'm an old man used to work in Ulster Spring. But anyway, this upbringing and exposure to the whole island, I think is a very good preparation for life and dealing with problems and staying calm, and confident.
True.
So your university is mostly in Jamaica here you studied?
It's all UA, pretty much.
So research days, you have been involved in research days also?
I've presented locally, internationally.
Well, thank you very much for having spoken with us, Dr. Andrew Bowers.
Thank you very much for having me, man.
Welcome. Thank you very much, yes, sir. Let's go for a break. Do we go for a break? Yeah, so go for a break, straight up. Yes, welcome back to Straight Up. I'm your host, Jerry Smallway. Broadcasting here from the Sickle Cell Unit. Today is Sickle Cell Day, World Sickle Cell Day and Expo. And the theme of the World Sickle Cell Day today, the theme this year is what you don't know about sickle cell disease may hurt you. We'll soon be talking to another of our guests or professional health professionals. But in the meanwhile, is there a call there? Yeah, in the meanwhile, just as people have to learn how to handle their peculiar conditions, some people are born with sickle cell disease, some people are born with a tendency towards it, although it is not fully developed. Some people are born with or develop or manifest weak eyesight. Some people are born with different conditions, and you'll have to learn how to manage it. So it is with our other conditions of life, whether it is poverty around us, or whether it is shortage of water in a certain country or in a certain part of a country, whether it is less educational opportunities and institutions. We have to cope with these things individually and collectively along with one another. We'll soon talk some more about the coping with these things. That you have here, I see you have glucose meters for everyday people. Now glucose meters are more connected with diabetes rather than sickle cell.
Yes.
But all in the promotion of self-care, the ability of people to manage their own medical condition, are true.
Yes.
If you listen to the voice of Miss Nardia Guthrie, and she is from HD Hopwood, not true?
Yes.
Yeah, so you are well known for providing these glucose meters.
Yes, we come under Abbott Diabetes Care. We have 3 glucometers out of Abbott, which is the Freestyle Lite, Freestyle Optimum, and the Precision Extra. Right? All the meters, they're available under the NHF. If it is that you don't have an NHF card, we suggest that you try and access one, because you're able to get up to 2 glucometers. One glucometer every 2 years under the NHF and
National Health Fund.
Yes, and all the glucometers are free of cost.
Free, yeah?
Yes.
Whether or not you have diabetes?
Well, once you're diagnosed as a diabetic patient, they're free of cost. You should let me get into the meters right now. The Precision Extra is the only one that is measured in milligrams per deciliter, which is that metric system is basically used in the United States. So for the retired patients who come home, who are comfortable with using milligrams, we recommend the Precision Extra to them.
Hold on. You mean the people who are living in North America?
Yes, North America.
They more read what kind of measurement?
Milligrams per deciliter. In Jamaica, we use millimoles.
Yeah.
Right? So we suggest for the retirees, the persons that come back to Jamaica, we recommend that they use the Precision Extra. Now, for those who aren't comfortable, we recommend the Freestyle Lite and the Freestyle Optimum, which is in millimoles per liter. Right? They're pretty easy to use, very small sample size. The Freestyle Lite is...
Sample is what, an amount of blood?
Yes. The Freestyle Lite is 0.4 microliters of blood, which is very, very small.
I'm talking everyday language. People understand.
Right, which is a little peck of blood. Yeah. So it's very small. So for those patients who are afraid to stick themselves...
so this meter also has a part that stick you?
No, it comes with lancets, which are a little tiny.
Lancet is like a small needle or
yes, exactly. And you have lancing devices inside.
Every time you use it, you can sterilize it, take off the germs.
No, it's used one time.
So how many lancets you get with one?
Well, what happens is that you get sample lancets inside the meters. But
how many?
Probably about 20, if so many.
So how can you get extra ones when you run out?
You can buy a box of lancets.
At pharmacies or at Hopwood?
Well, you buy them at the pharmacies.
You have to have any prescription?
No. So I was about to say that it has a lancing device inside that you use to gauge to stick yourself. So for those patients who have a fear of sticking themselves, they can use the lancets themselves, or you could probably put it inside the lancing device.
Yeah.
So let me tell you about the meters. I was saying that it's a small size, 0.3 microliters of blood. It's very, very small. The Freestyle Optium now, it is pretty easy to use. It's normally used on a large scale basis in hospital settings.
Yeah.
But sometimes we actually recommend usage to patients. The Precision Extra, as I was saying, that it is the Precision Extra is used in for patient use. Sorry, my bad. It's actually able to detect ketones in your blood. Ketones for patients who are diabetic. Once they have ketones in the blood, there are risks of getting diabetic ketoacidosis, which is a condition.
No, talking up here now. Ketone is a substance in the blood that shows that something ought to happen.
Yes, basically. Yes, so it's not a good sign. So once the machine is prompting you that ketones are present, then you know that you need to take a visit to the doctor.
Yeah.
Right? So for basically, if you really need to access the meters, just...
So how much lead time that warning give you? Like when you see that in the blood, how much time it does tell you must get to a doctor within an hour and a half, 3 hours or a day?
No, it doesn't tell you that, but ketones in the blood is just not a good sign, so you really need to get to your doctor.
How often are you supposed to check this?
It depends. Yes, really, daily. Some are actually twice a day before they take insulin, right? It is dependent on how your diabetes is controlled. Some persons are really not, the diabetes is not so chronic, so you find that they might do it every day, but really, some in Jamaica, you find that we aren't educated as it relates to diabetes, so we tend to not manage the illness that effectively.
Yeah. So there are other products that you have at table, but this is the main thing.
Yes, this is the main thing. We have
how bulky is this thing here?
It's very small.
It's about hand size.
Yes, it can fit in the middle of your hand. Well, my hand is small.
Yeah.
So it's very compact. But we have for in promotion of Sickle Cell Day, we have Painol, right, and we have Arthritis Plus, and we have Pain Freeze, which that with sickle cell they tend to have issues with pain, and this is all under the line of Genetics, which is another brand out of Hopwood.
So what is your training is with marketing or with healthcare or what?
I'm a medical representative, so I'm actually in the department of marketing.
But healthcare is what you're really delivering though?
Yes, basically.
You like it? You like the job?
Yes, I do.
I can see that you enjoy everything. What kind of graduation ring is that?
I went to St. Andrew High School for girls.
You know one for boys. So why them always have to say for girls?
You're making it difficult for me.
To do what?
You have to be special to go to this school. It's the best school in the entire world.
Yeah, I never see any boys' school have eyelash like you. Well, thank you very much for Miss Gertrude for having been here.
All right, thank you for having me.
Yes, ma'am. And I understand very much more now about glucose meters. I have some good friends, some elderly people who was using it, but I wasn't really as familiar with it.
Well, you need to tell them that they need to access our NHF card or any local pharmacy. They can go and ask for the meters. Again, we have the Freestyle Light, Freestyle Optium, and for those who are familiar with the milligrams per deciliter measurement, you can access the Precision Extra. The local pharmacy, every pharmacy is aware of these products, or you can contact HD Hopwood to access the glucometers. Right?
Okay. Thank you very much again.
All right.
That was Miss Guthrie, and she's trained in marketing and she's doing a good job, Miss Nadia Guthrie. Thank you very much. Do we go to a break or we have some time for some calls? Yeah, we have 4 more minutes. Could we run the numbers, please, because we have enough time to take a call and we're very interested in taking calls. Let's run the numbers, please. Straight up. Yes, welcome back to Straight Up. I'm your host, Jerry Small. We have just about 3 minutes to the news. That's the usual time of a phone call. Are you there yet?
Hello?
No. Yes, ma'am. Good morning. Welcome.
Good morning. Is this Small?
Yes, ma'am. How are you doing, ma'am? Are you here? Welcome and go ahead, please.
I
Welcome.
have workmen working. It's going to be hard for me to hear. I'm sorry. Hello, Mr. Small?
Yes, ma'am. I'm hearing you. Please go ahead.
Huh?
Yes, ma'am. Please go ahead, ma'am.
I better. Good morning, Mr. Small.
No, man. It's good. Don't hang up. Don't hang up. I'm hearing you well.
Yeah,
Please
the
go
noise
ahead.
is here. The workmen are working on the house and they're causing.
Yes, ma'am.
I better
Go
call
ahead.
back because I don't
No,
want to be
man.
able
Don't
to hear
call
you.
back.
Sorry.
No, man. No, man. Don't call back. Please go ahead now. I'm hearing you well.
Well, one thing I was waiting to hear comments made on is the predial larceny effect, where they found of the cows.
Yes.
And I'm surprised that nobody made any comments on it. When I saw the 2 lovely cows that the man stole,
Yes.
and another one, I saw 3 more.
Yes.
And I am wondering what is the reason why their faces should be covered. Why
Yes.
were their faces exposed so we could see who they were?
Well, I spoke about it a couple of days ago.
Oh, I
don't know
didn't
if you
hear. I'm
didn't
sorry.
I spoke about it. But on the other hand now, I am not sure if it is usual or if it is right for people's face to be exposed who are only accused and not tried
They're
yet.
not accused. They're caught red-handed in the act.
They haven't been tried yet, although sometimes we do see the faces and pictures of people who have been apprehended before they are tried. But, hello, ma'am?
Hello, I'm hearing you, sir.
Yes, similarly to when people are caught stealing goods in a supermarket, there is an alternative that is presented to the people in some supermarkets. Either you get charged with the crime, or if you don't want to be charged, you allow your photographs to be taken and put up in the supermarket, and a sign put on underneath it put say thief. But I think usually it is not usual for accused people's identity or faces. Sometimes it is done to be exposed to the public.
I am telling you, when I
But
saw
you
the
remember
cows,
that the man arrived, one of the men arrived at the police station just when his cows were being brought in by the police along with the thieves. I don't know if he's here, and I think we have to go to the left main line. Straight up.
Yes, welcome back to Straight Up. I'm your host, Jerry Small. We're broadcasting live here from the Sickle Cell unit of the University of West Indies, where the World Sickle Cell Day is being recognized. This is the 3rd year that we have been here, at least the 3rd year. And today's broadcast comes to you courtesy of certain products and certain companies. The first one is Ensure, Nutrition in Charge, Pharmaton, Be Alive, Precision Extra, your best friend for diabetes healthcare. B-Complex promotes general health. Painal Cough and Cold for rapid relief of all flu symptoms. And we've been, talking with the suppliers of the health care and the information and social workers, representatives of pharmaceutical companies about products and methods and research and new information about the management of sickle cell disease, and a few not really related but resembling conditions, such as we touched on some diabetic situations a while ago. Now, generally speaking about the program, it is my belief and sure knowledge that human rights apply to all human beings, just as animal rights apply to all animals. And therefore, I know that not only is it unnecessary for special groups of human beings to plead for special rights, it is, as a matter of fact, discriminatory for special groups to be claiming special rights. I am Rastafari. I cannot claim any special rights to Rastafari. I claim rights as a human being, and all human rights apply to me, and apply to all other human beings and all other groups of human beings. I am not stigmatizing any group, least of all the homosexual percentage of the world's population. Not stigmatizing any group. Not stigmatizing any group in the least. And therefore, I am saying that the rights of all human beings are covered by human rights. And for any group to be claiming special, peculiar, or peculiar vulnerability and therefore extra protection, this is inconsistent. This is a contradiction in terms. It cannot compute with human rights as against one another. Good morning and welcome to another of our caregivers and experts, Dr. Tamu Davidson, who is the Acting Director of Chronic Diseases and Injury Prevention Unit, MOH, Medical Officer of Health, I assume. Chairperson of our working group is Dr. Tamu Davidson there. Good morning. Have we connected with Dr. Tamu Davidson?
Hello, good morning.
Good morning, ma'am. How are you doing, ma'am?
Fine, thank you for having me on your show.
You are a medical officer of health with special responsibility
for public health
the
specialist with the Ministry of Health.
The Chronic Diseases and Injuries Prevention
Unit.
Yes, this is in the Ministry of Health.
Yes.
Right, thank you very much. Now, in respect of the sickle cell diseases and the sickle cell unit at the Mona campus of the University of West Indies, what does this working group? You're also the chair of the working group. What does this working group really oversee?
Well, there is a working group that was established by our chief medical officer of health a year ago, and this working group brings together key experts in the area of sickle cell. So we have the sickle cell unit, we have the sickle cell trust, we have also other members from the Ministry of Health. And our focus is on scaling up newborn screening island-wide. In keeping with our theme for this year's sickle cell, what you don't know may just hurt you. And so island-wide screening is very critical in identifying persons from early in the game with sickle cell disease. We also are looking to improve the quality of care for children and persons who are living with and affected by sickle cell disease.
I think I heard you mention a while ago Sickle Cell Foundation, and I think I remember speaking with.
Yes.
I think I remember speaking with someone from the telephone company, namely Mr. Miller, Mr. Errol Miller. Is he connected with that Sickle Cell Foundation?
No, this is Sickle Cell Trust.
Oh, Sickle Cell Trust.
Sickle Cell Trust is headed by Professor Graham Sargent.
Oh yes, Graham Sargent, who has done so much work from over the years. Yes. And he's still in Jamaica?
He's still in Jamaica, sure, and he's very active in working with us, the Ministry of Health, and the Sickle Cell Unit in improving access to sickle cell newborn screening. Professor Sargent in particular has been focusing on the southern region parishes and also in the western region.
By the way, are you a member of the famous family of doctors, Davidson?
Well, I'm not sure which one you speak to.
Pardon me?
I'm not sure which one you're speaking of.
No, the famous family of doctors, Davidson.
Oh, I'm not sure. Which Davidson is that?
You're related to Dr. Winty Davidson?
Yes, I am. I certainly am.
By how far?
I am his offspring, his daughter.
And therefore his wife is your mother, Dr. Davidson?
Yes, she is, certainly is.
That's great. And he's an expert in public health?
Yes, he is.
And in terms of preparing people how to manage diseases, especially diseases that people are born with, this is an aspect of public health, isn't it?
Yes, it's a critical component. In public health, we are custodians of the people's health. Our focus is preventing sickness, illness, and disease, and death. And so it is critical that in this case, a congenital disease like sickle cell disease, that once, we identify persons, and we can identify persons from in the newborn stage, we can at least screen babies, And we can counsel parents around how to manage a child's sickle cell disease from early if we identify it early. There's also another concept where if you know your sickle cell status, whether you have the trait or not, then we can counsel you as to how you select your partners. So you know if you have two parents that have the sickle cell trait, you have a 1 in 4 chance of having a child with sickle cell disease. So all of those interventions are necessary to put in place to prevent this morbidity and mortality due to sickle cell disease, and to allow persons to identify their illness early so that we can put in preventative measures to prevent them from dying early.
So as a form of, as a manifestation of public health, somebody who find that the person who they are attracted to and who enjoy mutual attraction with them, having the same sickle cell trait as themselves, they could have a limited, like a 5-year relationship during college, but if they're ready to reproduce, they would have to find a more compatible partner.
Well, this individual choice, who you have as your partner and who you decide to reproduce with. However, persons must be empowered with the knowledge, and if they choose to reproduce with someone with the trait, they have to know what the outcome is. And so we know that for every time that person is pregnant, there's a 25% chance or 1 in 4 chance that child would have SS disease. And so you need to know that before you actually reproduce. You have to be empowered with the knowledge. We have individual choice, and I think that's an individual choice that someone would make.
Now, as the unit, the name of the unit for which you are the acting director is Chronic Diseases and Injuries Prevention. Now, the chronic diseases suggest that these are diseases that are not preventable but manageable. But injuries prevention is another thing, because injuries prevention is proactive and preventive. Well, as the word says, preventive. So it is not the chronic diseases that is are the chronic diseases associated with injuries that are common to people and not unusual to people who have these diseases.
There is a link between chronic diseases and injuries. And just to highlight that, we know that the common chronic diseases today, such as your cancer, your diabetes, your cardiovascular disease, your chronic respiratory diseases, and even sickle cell as well, we know that these diseases can be prevented in some shape or form. So we know that 80% of type 2 diabetes, cardiovascular disease is preventable, and at least 40% of cancers. And so this is why we have put in this National Strategic Plan as of 2013, which provides a roadmap for addressing these common conditions. Included in the plan is also sickle cell disease, where we'll be seeking to scale up newborn screening so we can identify babies early who may have a trait or may have some form of sickle cell disease, ensure that they get into some care or preventative care to prevent any death or disability due to their condition. And also, importantly, is that people know what their sickle cell status is, so that if they choose to reproduce or get married or have children, that they know what it is they're getting into and they know what actions and steps to take. As it relates to injuries, many injuries lead to chronic conditions such as mental health disorders, substance abuse, also other things like cardiovascular diseases. So there is a link between violence-related injuries and also chronic illnesses. Some persons who abuse substance, who are substance abusers, also are ones who are likely to inflict injury, as you have seen in sometimes in cases of domestic violence, in just fights that occur, interpersonal fights in bars. There's researchers have shown that in some countries, what they've done is restricted alcohol or ensured that persons who are they don't offer persons underage to drink alcohol, because many of those persons drive motor vehicles. They end up in motor vehicle accidents when they end up in fights at bars. Many times, the data does show that a lot of these fights at bars or after clubs are due to the heavy consumption of alcohol.
Well, thank you very much for having here, Dr. Tamu Davidson. So it is that somebody who has a sickle cell trait should be very careful about forming reproductive partnership with somebody else of the same trait. So it is that if somebody has a trait of medical care and choose to reproduce with somebody else of a trait for medical care, is likely to reproduce somebody who will have great job satisfaction if them go into medical care themselves.
Yes. So, thanks. Sickle cell really doesn't only affect the individual, but it affects the wider society. And you have summed it up, even our choices in who we marry and reproduce with.
All right. Well, the family Davidson there, that is Miss Dr. Tamu Davidson of the family Davidson, a family of doctors who have produced an opposite trait to the sickle cell trait, which is a trait of good health. But thank you very much. Now we have two very interesting guests, but before we have these interesting guests, I want to hail what I have come to understand is one of my regular and enthusiastic listeners, Mr. Mario Guthrie. Mr. Mario Guthrie of Portmore. It's the second Guthrie we have had a talk about on the program this morning. I think there's some connection between the two. Mario Guthrie, who has some outstanding, at least one outstanding child. Mario Guthrie, father, is a father. And there's another Guthrie that was on the program this morning who is a daughter. So there goes Mario Guthrie. We have two very interesting guests. They have volunteered to come from their homeland in North America. One from the University of Michigan, both of them from the University of Michigan, undergraduate in sociology and medical anthropology, Chelsea Goldson. Good morning.
Good morning.
How are you doing? And the other volunteer is also from the University of Michigan and undergraduate in biopsychology, cognition and neuroscience, Miss Olivia Hobson. How are you doing, ma'am?
Good, how are you?
Fine, thank you. I found I was going through the sickle cell unit where some children were being cared for, both in the medical field and in the general field. And I found that you were reading, both of you were reading to the children.
Mm-hmm.
And is it your first visit to Jamaica?
Yes, it's our first time here. We've been here for about 5 weeks. Yes. Yeah. We're really enjoying ourselves too. We're experiencing a lot of different things that we're not used to.
Yeah, and you are from Michigan?
Yes, very cold.
Very cold at this time of the year?
Yes.
All the time. I understand that most people would understand that the most familiarity that most Jamaicans have with Michigan is knowing that Detroit is one of the car manufacturing capitals of the world, and Detroit is in Michigan.
Yes.
Where's Chicago?
It's in Illinois. Yeah.
Oh, Illinois. So I don't know the map so well, but I got the first one right. So what prompted you? How did you hear that you could volunteer to come to Jamaica?
We're actually in a program called MERT, and it's for MERT. It's MHIRT, and it's for minority students, and they basically give us the opportunity to go to different countries.
So what about you as minority?
I'm African American.
And what about you as minority?
I'm African American too.
And who is majority?
Caucasian.
Caucasian?
Yes.
You mean the people in America, the part of the population that comes from Europe?
Yeah.
Yeah. So as minorities, what is the program about?
So basically, it's different areas of health disparities. So here we're studying child development, and also autism.
Autism.
Yes.
And reading. Did you choose reading as a therapeutic thing to do for the children, or you were asked to read to them?
We were actually asked to read to them.
Yeah.
So yeah. It was a great experience.
Yeah. So in reading to them, do you find that the modulation of your speech, because right now I am modulating my speech, I don't talk like this all the time, but in order for you to hear me properly, I have to modulate my speech that you can distinguish the words. We both speak English, but you speak American and I speak Jamaican, but we agree to speak English at times together. So do you find that you have to modulate your speech for the children to understand the stories that you are reading to them?
Actually, no. It's kind of harder for us to understand the children more than I think for them to understand us.
You agree?
Yeah, I agree.
And you know the reason for that?
Well, I know for us in general, like the Jamaican accent itself is just like really hard for us.
And you understand why it's easier for them? May I tell you?
Sure, yeah.
Television and cable and music. So they are very easy to recognize your kind of accent. Matter of fact, they admire the coolness of the African American. That's how many people admire the attitude of the Jamaican. We love one another. Human beings love one another. They find some way. All human beings, most human beings love all other human beings. They find something. If you don't like the person's color, you like how they run, or you like something else. But it is natural for human beings too.
Right.
What else you tell? Tell me something.
Well, I know our first couple weeks here, it was really hard to understand your certain dialect. So we kept saying huh and huh. So, but now as we come along, it's actually pretty easy. She's speaking for herself.
It's not that easy for you?
No, it's very difficult for me.
Did you meet before university?
No, not before the program.
Did you meet before the program?
No.
And how many thousands of students does the University of Michigan have?
Ooh, a lot.
Yeah.
It's a lot, but it's only like 3% black students. There's some low students.
Yeah.
Some low number like that. It's not a lot of
Is it easy for you to recognize the Chinese American? Is it easy for you?
Or like to understand the way they talk?
No, to recognize them when you see them.
Yeah. Well,
After
not for me.
Chinese.
Not the Chinese Americans, because I don't know if they're actually from America or actually from China.
No, but whether they are born in America or not, they are Chinese American.
Okay.
But what it might be difficult is to distinguish whether they are Chinese Americans or Japanese American. But you realize that they are Asiatic American.
Yeah.
Is it easy to understand, to recognize the European Americans?
Yes.
Easy, because they are the majority.
Right, definitely.
And they know like how they are named after the place where they come from. Where are they named after? China, Asia, right? And Caucasian is named after the Europe or the Caucasus Mountains. And what are we named after?
We as in black people?
Yeah.
I will say African descent, but I know a lot of like African Americans were named after their slave owners.
No, not the personal name. We as a group. They are Chinese.
Oh, okay.
The name we named after.
I'm not sure.
Yes, you know, but you know what we are named. What are we named?
What?
Then how is it that they are named after the place that they come from? Asia or China, Europe or Caucasus, and we are not named after the place that we come from? How is it?
Great question. Was it because we were taken from our
No, it is
place?
because we accept other people's naming of us.
Oh, yeah.
But we are African. Why are they not named Yellow Americans? Or why are they not named Yellow Americans? Anyway, I welcome you so much.
Thank you.
Tell me something else about your visit here. First time in Jamaica?
Yes. We're actually visiting Ocho's Rios on Friday, so we're pretty excited.
Yeah. Are you going to go and come back the same day?
No, we're going to stay the whole weekend.
Nice, that's great. You heard what you do here? How about the food of Jamaica? You like?
We love Jamaican food. I think the jerk is our favorite. Yeah, then curry chicken. Yeah. Yeah, and we've tried some stuff ourselves. Yeah. We tried jerk burgers, which is good. I don't know if y'all eat jerk burgers, but
I think anything can jerk.
Yeah.
But you like the music too.
Yeah, we love it too. Yeah.
The only thing I don't like about the American music, the Black American music, African American music, I don't like when they refer to the brothers as dog and the sisters as bitch. But I'm not here to criticize them. Because I love them. I love you and your American brother.
Oh yeah, I definitely agree.
Yeah. No bitch could be so beautiful. Back to Straight Up. I'm your host, Jerry Small. We're conducting an outside broadcast here, inside out, because it's on the Mona campus of the University of West Indies. But it's actually at the Sickle Cell unit at the University of West Indies. This is the third year that we have been here, and we quite enjoy it. Interacting with the world of care of sickle cell condition, care by medical expertise and care by families who have been guided in the care of their family members who are born with the sickle cell condition. I want to run the numbers again, and I want to play a piece of music for you as usual. Until we have our next guest, could we run the numbers and entertain a few phone calls, please? Straight up. Yes, good morning and welcome to Straight Up. I'm your host, Jerry Small. Good morning.
Good morning, Mr.
Yes,
good morning,
welcome.
Mr. Jerry.
Yeah, man, welcome. How are you doing?
Yes, sir. What I'm looking now is, sir, I'm looking now into the wisdom of God. What happened here? God made Adam, and when he made Adam, as time goes by, he see that Adam lonely, so he make a Eve. So through our knowledge now, we look at it in this manner. Woman is my company. I live in peace among men, and make God be my friend. Because when God gave me woman, he gave me life. Because without the woman, I couldn't be here. And next thing again, man find themselves going to man. So man must look within his own self if it is cleanliness or it is uncleanliness. But that is his way of life. The other day I meet a few young guys and they were chatting. One said, if I catch men like those, I will kill them. I said to one, friend, I could say something to you. Then say, yes, big man, because we like hear when you talk to us. I said to them, say, look, you catch those persons doing that thing and you kill them. Now you get caught and find yourself in prison. So the thing that you kill those persons for, that's the same thing you find yourself doing. So what you must do, stay out here and be free, that you can even run from them. But when you're in there, you're locked up and you're backed up with them. So find freedom within yourself.
Oh,
and next
so,
thing again, I'll tell the last thing to you, Mr. Jerry.
All right, go on.
I meet a few young guys the other day. So one calls the other one T. I guess you understand what I mean. And he make up his face like he want to fight. I said to him, say, friend, I tell you something. It's one of the best name a person ever call you. And now him turn on me. So I said to him, say, look at it in this manner, friend. If it's such and such in talking, you were get through that passage. You were born through that passage. And you go back and comfort yourself. So what a blessing. So thank you must give. So instead we hear complaining, it's better we explain. And build one another mind.
Yes, okay. All right, my time now. You hear me?
Yes, sir.
So you said that some man find themselves going to man. I don't think nobody find themselves going to man. I think people make a decision and people must take responsibility for the decision. But the next thing is about it, as you said,
if a man decides to take action against other man because of what the other man do, which is not in business, as you say, him going to jump from out of the frying pan, or the frying pan is not liking what the guy do with the next guy, and him going to jump in at the fire, which is the prison where the oil run out, and them have to take now you make firewood. So don't jump from out of the frying pan, because you're going to find the oil run out and you turn the firewood in at the prison. And the thing where you never want, you have to take it. But thank you very much here, sir. Thank you very much. Now we have a question. Am I being heard? I don't hear myself on the monitor. We have a question here for which a gift basket is being offered for the right answer to this question. We're going to ask a question, and whoever can call in with the correct answer to this question first will get this gift basket. Now the question is this: what is the theme? What is the slogan or the theme or the headline for World Sickle Cell Day 2014? And little most I did read out the answer and give, but I never read out the answer and give. So you still get an opportunity to win it. Instead of get it free, or 20 people hear the answer and fight over the basket. The first person who know and tell me what is the theme or the headline or the slogan for World Sickle Cell Day, call in and tell me that. You get a gift basket. And it's not an empty basket. It's not a basket to carry water. Straight up. Now, we have another call. I think we have another call. Do we? Good morning and welcome to Straight Up. Hello?
Good morning, Mr. Small. It's just the health you're talking about and the gift basket.
Come again?
It's just the health you're talking about and the gift basket.
The gift basket, yes, ma'am.
Huh?
Yes, ma'am.
Sorry.
Yes, ma'am. Go ahead.
I can hardly hear you now.
Yes, ma'am. You're all right. Go ahead. Go ahead, please.
No, what I'm saying is it's just the health. This is just the health and the gift basket alone you're talking about. Hello?
If it is just what? Yes, we ask a question, and if you answer it properly, you get the gift basket.
Yes,
the basket not go empty. The basket going full of goods.
If it's just that alone you're talking about.
No, man, you can't talk. No, man, you can converse and bring your point or you do. You have to answer the question.
Okay, I just want to say, I have to get a book and write down when I hear some people and the news, because these are unedited. They don't have no money to run the children homes, and it's taking a lot of money. So they who want to come and adopt the children under good condition, she will make sure that them get the okay. I was the person who come and said, oh, you ever know, say, they're not raising them for their own purpose as homosexual and such is like. And I want to tell you, Mr. Small, there is right, never lose. There is wrong, always lose. That's a nice view, moment.
Well, thank you very much here, ma'am. Thank you very much. Next caller. Good
Where
morning.
are you, Mr.
Straight up, hello.
Mr. Small, where are you?
What go on, sir?
You get biggie.
Oh.
You and I talk good English.
I talk
what? You're not chat no patois today.
Chat up what?
You're not chat no patois today.
Yes, ma'am, we talk about patois.
I said Cameroon and Colombia play now.
Cameroon never gone home yet?
No.
You think they were gone home yesterday?
Eh?
I thought they were sent home yesterday.
Them and Colombia play today.
Oh, yeah. They finished play already?
No, man, no, they're not finished play yet.
Oh, yeah?
No one has scored yet, you know?
Yeah.
Yeah, man. Look more.
Thank you very much. We have any more call there?
Yes, sir.
Yes, sir. Welcome back.
Yes, if you don't know about sickle cell, it will hurt you.
I think we can give him that one, you know.
Huh?
I think we can give him that one, but don't put up your checkbook, you know, because you already commit yourself to buy a box of Ensure. But I think you win that one.
Right.
You get the that's the cutter.
Yeah, yes, I'm going to take both. I'm going to take the box as well.
Yes. Yes. You say you're going to turn the other cheek.
Huh?
You're going to turn the other cheek.
The other cheek?
And take the other box.
Yes, I'm going to take it both.
Oh.
Yes.
All right. Anything else?
Both is all right.
Thank you very much. So we know who you are and you will get the box.
Yes, all right, no problem.
Yes, sir. Have any more call there? Our guest? Oh, we have a break. After that, we're going to play a piece of music and we have something else to say and we have guests to entertain us. Stretch of the outside broadcast of the Sickle Cell Unit at the University of West Indies. And we are here year after year. And today is World Sickle Cell Day. And someone just won the prize of a basket for answering the correct answering the question with the correct answer. What is the theme of World Sickle Cell Day 2014? And the theme is what you don't know about sickle cell disease may hurt you. But what I know is this, that as I suspected and asked our last guest here, if you're enjoying our work, that don't help her to make her good at our work. And of course she confirmed it. And she even made us know that she is high ranking in our work. Not true, ma'am? Not true. And this is Dr. Rankin. What is the full name again? Dr. Angela Rankin Mullins. Not true.
Yes.
Yes, ma'am. And you are in the area of research.
Research.
Yes.
I'm a research fellow at the unit.
Yeah.
And thank you for having me on your program.
Welcome, ma'am. And you are a medical doctor.
A medical doctor.
Yes. And a scientist.
Yes.
Yeah, because as a
researcher. Role as a researcher.
Yeah.
Certainly.
And in your research, it also entails interacting with the live sickle cell patients. It's not just it's not just clinical.
Yes.
When I say it's not just lab work, it's clinical,
not just bench
clinical
work. It's certainly a lot of clinical work.
Yeah, as you put it the proper way, not just bench work, which means in the lab.
In the lab.
Yeah.
Yes.
And you enjoy it.
Certainly, we all enjoy our job.
Yeah.
It does have its moments of satisfaction.
Yeah, yeah. And it entails any travel? Are you asked to go abroad and to do any share your research?
Certainly, because coming on to the topic that I have been asked to do, education in sickle cell disease, we are sometimes asked to go to conferences, which may be locally in Jamaica as well as abroad. So we do travel at times. We do get that opportunity to travel.
And I see you have a lot on the page here prepared.
Yes. I do have some points I wanted to share about the role of the sickle cell unit in education.
Right.
And of course, our role in education is multifunctional and multifaceted.
Yeah.
We have a role to play by educating our patients and families. And of course, we have a responsibility and a commitment to educate the general public.
Yeah.
And lastly, and by no means least, we are also highly committed in the education, in the continuing education of our fellow or others in the medical profession.
Yes.
So fellow medical professionals.
Yeah, because with your specialization in sickle cell, it is also necessary to alert the general practitioner, even some specialist practitioners.
Certainly, because a lot of our patients are actually co-managed.
Yeah, managed both by yourself
and by others in our setting.
Yeah.
So it's important that we bring our medical professionals up to speed and also update them as different things change in the management of sickle cell.
So the care must be compatible.
The care must be compatible. The care must be comprehensive.
The care between both sets of caregivers.
All
in other
caregivers.
words, you don't want one set of doctors saying, take sun bath, and the next one telling the person, keep out of the sun.
Certainly, that is a good example. So we want everyone to be able to be well updated on the management of sickle cell and the care of sickle cell.
Yeah.
Okay.
There's plenty more on your page here.
Well, I actually just brought along a few things. I know our listeners can't see them.
Yeah.
But in terms of our patient education, we do have patient education leaflets.
Yeah.
And they are available in the clinic. And just of late, we have an education committee within our unit, and we're actually putting a children's story together. It's a lovely children's story, and the name of it is Me Too. And it really is geared to children between the age groups of 6 to 9. We hope that by the end of the year we'll have this book in addition to our patient leaflets that we now have available at the unit. The patient leaflets are also on our website. And going onto the website, any professional, any health professional can actually download and print our patient information sheets as well. In terms of patients and their families, once they come to the unit, there's also intensive counseling about the disease. And the intensive counseling usually takes place on the first visit. In this visit, we usually say what are the possible complications of sickle cell disease, whereas we can't actually say what will happen to the child. Because sickle cell disease is such a variable disease that a lot of it is unpredictable, the course of it.
So the outcome is variable.
Yes.
Although it can be influenced by well-informed care.
Definitely. But we do, certainly at that first visit, we'll say what can happen or what are the possibilities. Apart from our intensive counseling sessions, we also have patient education sessions, and we had one such session this morning, they're usually well received. So a number of topics are dealt with. We have our staff members, and we are in teams, and depending on the team that is going to be doing the patient sessions for that month. But we are doing a variety of topics. At the moment, we are dealing with genetics, and that means just discussing how the disease is passed on from one person to their offspring. Okay, of course, education is deeply embedded in our mission statement. And our mission statement certainly is improving the lives through research, education, and clinical care. So we have a three-pronged approach. So we know education features very big in our mission statement. Our public awareness campaign, of course, we have World Sickle Cell Day today. And we also, a number of us, as members of staff of the unit, we also go to speak to groups, church groups. We are also heavily involved in health fairs. And we certainly have, opportunities in terms of media opportunities, both television and radio. And we are usually, we grab any opportunity that we get to educate and raise the level of public awareness.
So now, as you mentioned, grabbing any opportunity to get to raise public awareness. Quite in contrast, and probably as an example, for others who have yet to learn the best way. It is quite appropriate for young children to be told in relation to sexual reproduction that if you have sickle cell trait long before they are ready for adolescent or mature romantic contact, it is quite appropriate to tell young children that if you have sickle cell trait and if you marry and have children with somebody who have sickle cell trait, that is a danger. And in that way now, you are preparing the children about sexual choices in terms of partners and not in terms of eroticism and different sexual practices.
Yes, I do.
And this kind of propriety, which also involves the consultation between the different teams.
Yes.
The different medical teams. So it was so other groups that have run into problems could learn a lot from your units by consulting and doing the proper thing and the proper age-appropriate instruction.
Age-appropriate, and that's what I was going to say. It certainly is appropriate, but age-appropriate messages.
But thank you very much for having been here, Miss Dr. Gertrude, Dr. Angela, not Gertrude.
Rankin.
Well, Miss Gertrude, wind up my tongue. And, again, Mr. Mario Gertrude, see what your daughter to do. But Dr. Angela Rankin Mullins, thank you very much, medical officer.
Thank you very much. Certainly good.
I also want to thank my producer,
Thank you,
Tanya Richards. And I want to thank broadcast technician Barrington Campbell on location and Kevin within the studio. I want to thank the sponsors also. The sponsors of this broadcast came Ensure, Nutrition Charge, Pharmaton, Be Alive, Precision Extra, your best friend for diabetes healthcare, B-Complex, promotes general health, Painol Cough and Cold for rapid relief of all fluid symptoms, and Business Development Officer Floyd Ives, and also what them name again, HD Hopwood and some other sponsors. But I was born no earlier. Remember that piece of music? Line it up for me, please. And it is Nathaniel Fox. I want to play that piece of music. And I say again, just as I say, there should be no special rights for any group, but human rights covers all. Therefore, no group should seek any special influence over the world, over nations, over communities in favor of themselves. Just human rights. So it is Rastafari. I'm a Rastafari. Rastafari cannot seek any special rights over anybody else. Black people cannot seek no black supremacy over anybody. All of us are the same. And I advise us in this way. I was born no earlier. Nathaniel Fox, straight up.
I was born no earlier, no later than any other man on this globe. I'm no more, no less than any other man. Today man sees all his hopes and aspiration crumbling before him. He's perplexed and no longer.
Good afternoon, it's time for the midday news here on News Talk 93 FM. I'm Errol Lee. Coming up in this newscast, JFJ loses another board member amid sex education program row. Former Contractor General Greg Christie dismisses Attorney General's position that obstructive bureaucracy hurts the fight against corruption. Auditor General says government calculation of public debt creates difficulty to assess target reduction policy. And alumina hydrate removal from the Salt River completed. Now the news in detail. Another member of the board of Jamaicans for Justice, JFJ, has resigned from the board. According to reports, Susan Evans has stepped down as a director. Her resignation follows the decision by former JFJ Executive Director Dr. Caroline Gomes to resign as a member of the board following the controversy surrounding a sex education program carried out by JFJ in 6 privately run children's homes. It also follows several cries from politically affiliated groups who have called for the resignation of the entire board. Meanwhile, a press conference is currently underway with representatives from the Caribbean Vulnerable Communities Coalition over the sex education program. The coalition-funded program, administered by JFJ, promoted the acceptance of anal and oral sex. Dr. Caroline Gomes, who is now the executive director at the coalition, was executive director at JFJ when the sex education program was developed. The coalition says it intends to outline its functions and its involvement in the controversial program. The main issue of the program has been the content and the appropriateness of the material for children. Former Contractor General Greg Christie has responded to statements made by Attorney General Patrick Atkinson during his contribution to the sectoral debate in Parliament yesterday that Jamaican authorities should avoid the use of obstructive bureaucratic methods in the fight against corruption. However, in a series of tweets on social network Twitter yesterday, Christie said it is the government's refusal to submit to the rule of law and best practices which are barriers to investment. He said beyond making promises, the government has done nothing to send a persuasive signal that it is serious about fighting corruption. He also said the government's signal suggests that it lacks the political will and courage to do the right things. Christie says if the government was doing the right things, Jamaica would not have such a poor ranking in the corruption index. Jamaica is currently ranked 83 out of 177 countries on the Worldwide Corruption Perception Index. Opposition spokesman on Labour and Social Security, Pernell Charles, says the government should abandon plans to invest National Insurance Fund NIF money in a newly privately owned cement plant being planned for St. Catherine. Addressing the House yesterday while making his contribution to the sectoral debate, the opposition spokesman said Minister of Labour and Social Security Derek Kellier had revealed that the failure of contributors to the National Insurance Scheme NIS, which finances the NIF to match benefits, was endangering the viability of the fund. Charles said that if that is the case, he couldn't understand why the NIF is considering investing in a cement plant. However, he says the government should use the money to support a program to identify Jamaicans who can most effectively be transformed into the skilled workers that the country needs, and to do so with full recovery to the fund so that it can provide the pensions that are due to NIS contributors. Concerns have been raised over the government's decision to amend the law which will remove the power of the Office of Utilities Commission, OUR, to regulate public transportation. According to attorney-at-law Hugh Wildman, who is representing the Rural Transit Company Limited in its lawsuit against the OUR, Transport Authority, the JUTC, the Commissioner of Police, and the Attorney General, the move is scandalous. The House of Representatives yesterday approved a resolution which called for Item 2 of the first schedule of the OUR Act to be removed. That provision gives the OUR the power to regulate public passenger transportation by road, rail, or ferry, but Wildman says this action goes against judicial principles. Meanwhile, transport operators say they plan to respond to the new developments in the lawsuit at a press conference this afternoon. The group, among other things, is seeking to reverse the decision of the authorities that prevent them from picking up and setting down passengers in the Kingston Metropolitan Transport Region, commandeering a section of the Mandela Highway for the exclusive use of JUTC buses, and refusal to renew some JUTC franchise holders' licenses while overcharging others. Arguments for an injunction will be heard next week. You're listening to the Midday News on News Talk 93 FM. It's 6.5 minutes past 12. The Greater Portmore Joint Council, GPJC, has joined civil society groups and trade unions in rejecting the proposed increase in toll rates. Trans-Jamaican Highway has applied to the Toll Authority for an adjustment in the toll rates, but Chairman of the Greater Portmore Joint Council, Howard Hamilton, says an increase now would undermine efforts by the Jamaica Urban Transit Company to improve profitability. He also said public sector workers facing a salary freeze cannot afford higher toll charges. Hamilton says it's time for the adjustments to toll rates to be subjected to public consultations. Auditor General Pamela Monroe Ellis says the manner in which the government calculates public debt makes it difficult to say whether its reduction target is realistic. The government wants to reduce its public debt to around 60% or less of the gross domestic product by the end of 2026. At the end of March, Jamaica's total public debt was 1.946 trillion, or 131.9% of GDP. However, the Auditor General says she's not able to determine how the debt to GDP target will be achieved because the projections presented in the fiscal policy paper are not in keeping with the definition of public debt. Monroe Ellis made the declaration in a report to Parliament. The Financial Administration and Audit FAA Act requires the Auditor General to examine the components of the fiscal policy paper and report to the Houses of Parliament. The National Environment and Planning Agency, NEPA, says the alumina hydrate spilled into the Salt River in Clarendon following Monday's accident involving a Windalco contracted truck has been safely removed. According to NEPA, the hydrate was removed from the waterbed yesterday by a team from Windalco in the presence of the incident response team from NEPA. Windalco was mandated to take specific actions to remove any trace of the alumina hydrate in the sediments of the water. NEPA says it is collecting water samples to determine the impact of the spilled alumina hydrate on the water quality of the river. On Monday evening, a Windalco contracted truck hauling approximately 35 tons of alumina hydrate from the Ewerton Works refinery to a temporary storage facility at Salt River overturned in the river at approximately 4:40 p.m. NEPA says the area has been declared safe. Meanwhile, NEPA has reported a 41% increase in the number of enforcement actions taken against companies and individuals in breach of the various environmental and planning laws. The announcement was made by Minister of State in the Ministry of Water, Land, Environment and Climate Change, Ian Hales, during his contribution to the sectoral debate in the House of Representatives. Hales says the number moves from 633 enforcement actions in fiscal year 2012-13 to 893 for the period 2013-14, which included cessation orders, enforcement notices, stop orders, and notice of intention to suspend. A man and a woman were injured in a motor vehicle crash involving a police service vehicle in Rockford, Kingston last night. Eyewitnesses say members of a police team were chasing two men on a motorcycle at about 6:30 p.m. when the incident occurred. The witnesses say the police and the pickup were chasing two men on a bike when the police van crashed into a Toyota Corolla. The couple, who were occupants of the vehicle, were reportedly injured. Police sources say the men had committed a robbery in the area and were making their escape when they were intercepted. Two police officers who have been accused of killing alleged thief George Green and planting a weapon on his body are to face a preliminary inquiry on September 24. The date was set when Constable Evanine Gallimore and District Constable Kmar Sewell appeared before the Manchester Criminal Court yesterday. Investigators from the Independent Commission of Investigations, Indicom, says that on March 19, 2012, the policemen responded to a call of a break-in at a supermarket on Main Street in Christiana. Green, who was hiding in the store, was shot dead by the police after he allegedly attacked them with a machete. However, Indicom investigators examined footage from a closed-circuit TV in the store, which captured the incident. The images reportedly showed Green being shot while hiding behind the shelves. The images allegedly showed one of the cops leaving the building and returning with a machete, which was placed beside Green's body. Regional trade policymakers are being urged to ensure that gender equality and gender mainstreaming is integral in their future foreign trade policies and national development strategies. This advice comes from representatives of the Caribbean Development Bank, the CDB, and the International Trade Center, the ITC, during day one of a 4-day seminar examining gender mainstreaming in Caribbean trade policies and programs. During the opening ceremony, officer in charge of the projects department at CDB, Deirdre Clarendon, said while significant progress has been made in the area of gender and gender equality, the post-2015 agenda must further embrace gender equality to identify true growth. And finally, in the midday news, Iraqi government forces are battling a Sunni Muslim militants for control of the country's biggest oil refinery. Officials insist that security forces are in full control of the Baiji refinery, which is north of the capital Baghdad. But militants led by the Jihadist Islamic State in Iraq and the Levant ISS have surrounded the facility. The fighting comes as U.S. President Barack Obama considers a request for airstrikes against the militants. And that's the midday news. Let's look at the weather. There is a trough across the Western Caribbean, including Jamaica. This trough is expected to be the dominant feature for the next 3 days.